All right, so we're going to look here at osmosis. Now, osmosis is going to be the movement of water across that semi-permeable membrane. Remember, semi-permeable means that certain substances are allowed in and certain substances are restricted. All right, so there's that net flow back and forth across the membrane by some substances and not by others. Okay. Now, as far as osmosis is concerned, instead of having solutes moving back and forth across the membrane, we have water moving back and forth across the membrane. All right, and typically this will move from low solute concentration to high solute concentration. So in other words, we say that it wants to dilute. All right, we want to even it out on both sides, right? So we want to dilute. So we're going to move water from high water concentration or low solute concentration to the other side, where we have higher solute concentration or lower water concentration. Hopefully that makes sense. I like to remember it as in a way, if we go from high concentration to low concentration, it's going to be from high solute concentration to low solute concentration, just because that's consistent with the other terms that we've learned. But you'll have to organize it for yourself and for your own understanding. Okay. Now, in order to do this, we have what's called osmotic pressure. Now, that osmotic pressure is going to be the minimum pressure that needs to be applied to a solution to prevent the net flow of water across a semi-permeable membrane. So this is basically like it's pushing back. So osmosis does not occur. All right, this doesn't encourage osmosis, but in this case, it will counteract it. All right, so it prevents osmosis. So that's really important when we talk about edema, all right, and ensuring that you don't have water going into spaces where you don't want it to. All right, now water is going to naturally move from an area of low solute concentration to high solute concentration, and again, to stop this movement, that pressure, that osmotic pressure, is going to be applied to the side with the higher solute concentration. All right, we say this is governed by Van Hoff's law. Now, I have a formula here. You're not going to have to do any of the calculations, but just be able to interpret what these mean. All right, so here you have pi indicating osmotic pressure, R is your gas constant, T is going to be absolute temperature in Kelvin, and C is going to be molar concentration of the solute, which is moles per liter. All right, and this is going to show osmotic pressure is going to increase with solute concentration and temperature. All right, now, again, osmotic pressure is not going to encourage osmosis directly, but the solute concentration differences and the presence of that semi-permeable membrane will encourage osmosis by creating the concentration gradient. A good example of this would be, let's say we have a sugar solution and we have this osmotic pressure. Imagine you're going to have these two compartments right here. It's going to be separated by a semi-permeable membrane. Okay, compartment A is going to contain pure water, and compartment B is going to contain water with dissolved sugar. So naturally, what would happen? Those molecules in compartment A, where their pure water is, will move into compartment B, into where the sugar solution is. And the reason is because the sugar in B creates that higher solute concentration. All right, this movement of water into B is called osmosis, and it's going to occur to balance the concentration on both sides of the membrane. All right, now to stop water from moving into compartment B, what you would need to do is apply a certain amount of pressure to compartment B. All right, this pressure is going to be what we call osmotic pressure. Now, the higher the concentration of sugar in compartment B, the greater that osmotic pressure is required to prevent water from entering. So in a real world scenario, let's have a medical example. All right, when you have IV fluids, that osmotic pressure of the solution has to match the osmotic pressure of blood plasma. If it doesn't, the solution with a lower osmotic pressure, or the hypotonic solution, will cause water to move into blood cells and it'll make them swell and burst. A solution that has higher osmotic pressure, which we call hypertonic, will draw water out of red blood cells and it'll cause them to shrink. And I'll give you an actual example of this, and we'll do some problems with this throughout this section.